Guys, let us very quickly look at treatment of typhoid that you need to know in main points. Okay, so basically what they give, right, commonly that you should know, they will give ciprofloxacin or levofloxacin. See, it is an or here, ciprofloxacin or levofloxacin. This is not, these are nothing but fluoroquinolones, right? And this typhoid, Salmonella is gram negative bacteria, remember. So they are giving ciprofloxacin or levofloxacin. How much they're saying? Ciprofloxacin 750, levofloxacin 500 they are giving. Let's put a 500 image weight. So it is either this or this, remember, and these are given based on the complications, right? Uncomplicatedly, they are saying this, and how many days, right? They are saying, and apart from this, what they can give if they admit, right? They are saying it is ceftriaxone, that is a cephalosporin, right? Third generation that you can give this, but you have to admit the patient, right, to give IV, etc. But otherwise, I have seen people give Cefixime, which is nothing but written as Taxim, that XIM, you see, okay, Cefixime, XIM, Taxim, XIM. So just remember like that. This is what they give if they cannot admit or something. But otherwise, it is not there in textbook to actually give this. It is actually ceftriaxone. Other than that, you can give ciprofloxacin, levofloxacin. Okay, and the other thing they are saying you can give is azithromycin. You can increase the dose of ceftriaxone, right? Or you can also use azithromycin for uncomplicated cases. They are saying azithromycin, how much? 500. Okay, so these are the only drugs you need to remember for treatment of typhoid. That is why this slide has been made. Fluoroquinolone, ciprofloxacin, levofloxacin, cephalosporins, third generation, ceftriaxone IV, cefixime tablet, which is also prescribed, and then azithromycin you can add. Okay, so do you know what causes typhoid? Enterobacteriaceae family bacteria, that is Salmonella. So it is a pathogen. It will sit in your intestine, right? It will cause a lot of fever and not treated by the usual antibiotics that people give. So you have to give these antibiotics, okay? So here, look at the classification of ciprofloxacin and what else you saw? Levofloxacin, right? This is nothing but fluoroquinolone, that quinolone antimicrobial, okay? So where is the classification? You should know ciprofloxacin, levofloxacin, okay? The ciprofloxacin, guys, it is also coming under anti-tubercular drugs also. So you can use it even to treat tuberculosis, okay? But then it will be a long, I think tuberculosis treatment will be long, but here we are talking only about a few days of treatment, okay, when it is typhoid. Now we have finished the classification of ciprofloxacin and levofloxacin. Now let us look at the cephalosporins. So look at the cephalosporins here. You have, where can you spot our ceftriaxone? See, it should be third generation, right? Definitely. Otherwise, what's the point? So where is third generation? Cephalosporins are here. Give me a better color, please. Okay, cephalosporins are here, third generation. We are here with parenteral. Parenteral will be ceftriaxone. Very good. That is IV they are giving, right? And oral you have cefixime. Okay, these are the drugs you should know. Okay, now fourth generation, leave that. Now mainly you have to focus in life on cefixime and ceftriaxone. Okay, these you have to know in the world. Okay, cefixime oral, parenteral, ceftriaxone. How much ceftriaxone you will give? 2 gram intravenously for 7 days. Usually it's a 1 week type of a treatment, looks like, and it is also very effective. They have written here, which got hidden. Okay, so this is our ceftriaxone bottle. Is it 2 gram? Yes, it is 2 gram. Wow. Now where is our cefixime? Cefixime is used to treat enterobacteriaceae infections. Okay, so anyways, that was written here, but actually in treatment of typhoid, what you have in the textbook is ceftriaxone and not cefixime. Okay, I just wanted to tell you that. But if the patient is, you want to give oral and not IV, okay, looks like that they are prescribing this. Okay, coming to azithromycin, let us look at azithromycin now. So this is the last one, right? Okay, so you're very happy, no? So azithromycin, it comes under macrolide antibiotics. Under what? Macrolide antibiotic. Okay, so basically it is an antibiotic. It is going to kill the bacteria. If you have one more second now, let us look at how these bacteria act also. Sorry, how these antibiotics act also. What do you say? How do you think fluoroquinolones act? DNA gyrase inhibitor, I think. You need to know them. So for the bacteria, this is going to be bad. Why? Because the fluoroquinolones will inhibit the DNA gyrase part A. How do you think the cephalosporins third generation work? Okay, they are doing cell wall inhibit. They will inhibit the synthesis of cell wall. I will put it like this: cell wall synthesis inhibit. That is about ceftriaxone. Okay, cell wall synthesis it will inhibit. How do you think azithromycin works? Azithromycin, macrolide antibiotic, it will do protein synthesis inhibition. Macrocyclic lactone ring, something they have written here. So let us see this. Let's write it for our own reference. Ciprofloxacin, levofloxacin, that is fluoroquinolones, antimicrobials, DNA. They affect the DNA gyrase something. Okay. Then you have the cephalosporins third generation. Cell wall synthesis, they will inhibit. Cell wall. Coming to azithromycin. Protein synthesis. Proteins inhibition. Protein synthesis. No protein. So all the three seem to be affecting different things of the bacteria, and that's nice, right? Okay. Sometimes in family medicine, I have seen that they treat the patient for typhoid if there is long duration fever, even though the vital is not very significant. Okay. And in general, remember, you should always give paracetamol for the fever, diclofenac, and symptomatic treatment you should do. Okay. Diclofenac, pain for the pain relief. Okay. Now I would like you to focus on this thing, treatment of carriers. Okay. So look at this treatment of carriers. It is again ciprofloxacin only, so it is easy for you to remember, right? Then they will remove the gallbladder, cholecystectomy. Okay. You should know. And what else? They can even give ceftriaxone, but who's going to get admitted and take IV, right? But anyways, that is also effective. That's what the other books say. You can also give ampicillin, trimethoprim sulfamethoxazole. That is nothing but clotrimazole, right? Chloramphenicol. Again, all these are. This one is an older drug. So only they are talking about these drugs which are like these names you would have heard earlier for typhoid treatment. They are used only for treatment of carriers now. Ampicillin, trimethoprim sulfamethoxazole, chloramphenicol. Okay. So these three, okay, they are talking only in the context of carrier. Remember, ciprofloxacin mainly same drug only they are talking. So basically, whenever people come with diarrhea, etc., no, they treat the again with ciprofloxacin. See, there can be constipation or diarrhea, right? So that is why whenever people come with diarrhea, and if they are food handlers, they are given this ciprofloxacin. For you, the job is to get marks in the exam. So you have learnt 3 new drugs. One is ampicillin, and the combination drug, right? And then what was the last one? Chloramphenicol. What was this combination drug? Trimethoprim sulfamethoxazole.